take an oath as doctors to do no harm, right? And then we're put in situations where we see harm being done to patients, and there's nothing you can do about it.
Paging Dr. Cook. Paging Dr. Cook. Dr. Cook, you're wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for the podcast, which is a production of MD Coaches, providing leadership and executive coaching for physicians by physicians to overcome burnout, transition your career, develop as a leader, or whatever your goal might be. Visit MD Coaches on the web at mymdcoaches.com because you're not in this alone. And don't forget that CME credit is available when you listen with us. Just look for CMify in the show notes to learn how. My guest today is an orthopedic surgeon currently practicing in York, Pennsylvania, and he is also a committed advocate for physician-led healthcare, a topic on the minds of lots of physicians in the U.S. today. So let's hear my conversation with Dr. Joseph Alhadeff. I'm really looking forward to my conversation today with Dr. Joe Alhadeff. Joe, welcome to the show. Thanks for being here.
Thanks for having me. So
let's go ahead and begin as we always do, and that is at the beginning and talk about your origins. Were you, have you always been a Pennsylvania resident, or were you a Pennsylvania native or not?
I was not. I actually grew up just outside of New York City in northern New Jersey.
Oh, did you really?
But my mom's side of the family has deep roots in Pennsylvania. She grew up in Pennsylvania, and her side of the family has been in Pennsylvania since the late 1700s, so they've been here a long time. But yeah, for me, it started out in northern New Jersey in a town called Paramus.
I see. Well, let's talk about the influencers that got you interested in medicine. Was that an early aspiration or not? I noticed that you actually, during your postgraduate years, you actually did a little something you didn't go directly to medical school after undergrad,
No,
did you?
I did some marine biology work with the School for Field Studies. That was a program that was set in Baja, California. And it was originally, I think it's designed, and the majority of students that participate do it as like a semester abroad, essentially, as part of their college curriculum. I didn't have time to work that in during my undergrad years, so I did it right after I graduated for that first semester. So it kind of ended up as like a post-grad work, but it was undergraduate level material.
Was your intention when you finished up at Harvard to go to medical school?
Well, that was the reason I did the semester essentially in Baja, California, because when I was at Harvard, I, for all intents and purposes, thought I was going to be a marine biologist. And that's kind of what my focus was. I did an independent study program there and did a little bit of very rudimentary research that you could do.
I see.
Basically book kind of stuff. And I had very little exposure to medicine early on. Neither of my parents are doctors. I don't have any brothers or sisters or anybody in my family that is medical in any way, except maybe an older cousin that worked as a microbiologist and geneticist for Sloan Kettering, but she was all in the labs. So that was the only thing that was even vaguely medical related. And she was probably about 10 to 12 years older than I was. But it was something that I thought might be a possibility. I did all the pre-medical school requirements just in case. But then I was kind of torn between, do I do medicine or do I do marine biology? And in the summer of my junior year, between junior and senior year, I had done a medical student program that was set up for kind of college students to do at one of the local hospitals in northern New Jersey. It was set up at Pascack Valley Hospital. And it was, I think, 8 students that they had, and they set it up. It was one of the old internists that worked there that basically gave us rotations through different parts of the hospital with different doctors and in the radiology lab and the ER. We went out on some calls with the EMS service, but it was designed to give students in college some type of medical exposure to see if it was something they were interested in or not. And I really liked it. I actually met my future wife there, although I didn't know it at the time. But so it was a good program for me in more ways than one. It was my first chance to really see what it would be like to be in medicine. I really liked it. But then I had been doing a lot of marine biology work at college, so I felt like I had to do something to explore that as well. And I wasn't quite as definitive then as I have become later in life. Surgical training will do that for you. It makes you a better decision maker. But so then I decided I had to try the marine biology thing. And this looked like a very cool option if nothing else. And I don't know that I necessarily planned it out the best, because I probably should have applied to medical school and then deferred a year. But I didn't really understand how the medical school admissions process worked. And what I did is I went to Mexico and did this program. And then that would have been the time that I should have been applying to medical school the next year, if that's what I decided I wanted to do. But, back in the 1990s, trying to apply to medical school from Mexico was just about impossible, because nothing was on the computer. Everything was done by mail, and we had to deal with the Mexican mail system and stuff. So there was just no possible way I was going to be able to get all my transcripts and everything ready that I needed to do for medical school admissions. So I had to wait until I came home and then apply the next year. So I ended up being 2 years off in between college and med school.
Do you really regret that at all, or do you think there might have been some advantage to taking a couple of years to season yourself before entering medicine? What do you think?
I definitely think it was helpful. Definitely want to try and get right into it. And there's the 6-year medical programs that are popular. People want to try and decrease the amount of time to get there. I don't know that that's always the best thing. I think, there's not one right path for everybody. For me, I don't know that I have any regrets, because it is what it is. It's how my path worked out. If I had planned it differently, I would have done different things, but I don't know that it would have been any better or worse. I'm pretty happy with where I ended up in the long run. So I don't necessarily have regrets about not getting there faster. I think that's one of the problems with our society, is we're in such a hurry to get from point A to point B all the time that we sometimes miss things along the way. And
so true.
I worked as a computer consultant for a year and a half instead, and picked up some valuable computer skills that probably helped me more than I realized, as things have, obviously it's become much more of a thing now than it was then. I don't necessarily regret that. And it gave me, again, that was when I was dating my wife, my future wife. So we were both in the same area at the time. So I don't necessarily look at that as wasted time. It was time well spent.
Yeah, I would agree. I actually started a medical school in 1972.
Okay.
And they thought they were doing something really brilliant. They decided that they were going to run us through in 3 years. And that system lasted exactly 2 years. And it clearly just the wrong way to do things. And I can see that you certainly don't have any regrets about taking that space between your baccalaureate degree and getting started. And I've never heard anybody say they wished they had gone faster.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
We'll get back to our interview in just a moment, but first, I'd like to share a message from Navigate. You know, after spending years in the financial sector, Navigate has met lots of clients with all kinds of student loan issues. They were confused, they were overwhelmed by the doublespeak and the overly complex forms, and especially the deliberately misleading statements from loan servicer representatives. Navigate recognized the chaos in the student loan industry and immediately brought clarity and real solutions. If you'd like to flip the script on student debt, visit www.flipthescript.loan/MD-coaches to schedule a call with Navigate. They'll tailor a plan specifically for your unique situation and work with you until the loan is paid off. What do you have to lose besides the stress of student loan debt?
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests. Whether it's writing, painting, cooking, politics, and dozens of other topics, Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview. Well, with this base of improved maturity and so forth, how did you come to the decision that your career was going to be in orthopedics?
Not really a great decision maker at that point either, because I was deciding between internal medicine and orthopedic surgery, which seemed like opposite ends of the spectrum. There weren't a lot of other surgical subspecialties that really appealed to me the way that orthopedics did. My dad worked in construction, and I liked the idea of using my hands, and orthopedics is, a lot of the tools are similar to construction. We're using hammers and saws and drills, and that seemed to draw me a little bit. And there were a lot of basically orthopedics, in my opinion, has the coolest toys, or at least back then they did. I mean, there's other specialties now that have neat things that they do with robots and stuff, but I liked the idea of being able to treat people through different age groups, from anywhere from young to old. Everybody's got some orthopedic issues at some point. And the problem solving that you do in internal medicine was also very appealing to me, because sometimes I geek out and get very cerebral about things. And to me, when I was training, those were the doctors that really thought about things the most, and they would get really excited when patients would come with complex problems and how to figure them out and how to think about the whole person. And I liked that. I liked some of my mentors, and that was as I worked through, I kind of decided that everybody that I was friends with were like, you're an orthopedic surgeon. You're, a jock. You're tall. You're, brash. You go into orthopedics. You're going to drive the internal medicine people nuts if you
strong as a bull and twice as smart, right?
Yeah, or half as smart or something like that. Yeah. But that's where I kind of ended up. And then when I did my actual clinical rotations, which I enjoyed much better in medical school than I did the basic science. When I did my first orthopedic rotation, I was like, oh yeah, this is where I want to be.
It seems to me, and you can correct me if I'm wrong, but it looks as if there was a point where you felt that a better understanding of how the business of medicine works is rather important, to the point that you went and got an additional graduate degree. Can you talk about that a bit?
Sure. So, I had held some leadership positions as like chairman of the orthopedic department. I started out my orthopedic career in Roanoke, Virginia at the Roanoke Orthopaedic Centre and worked there for almost 8 years. And got a lot of valuable experience there, both clinically and in leadership roles within my group. But it was a little bit of a smaller group. It was a larger hospital and had to figure out how to work within the hospital system. And realized that there was a lot of external factors in medicine that really impacted the way we were able to practice. And one of the biggest differences between practicing in Virginia and practicing in Pennsylvania, where I am now, is that Virginia is a certificate of need state, or at least was then. I don't know if they still are, which meant that you couldn't just build something. If you wanted to have an MRI machine or you wanted to start a physical therapy practice, there were a lot of rules and regulations you had to jump through and had to get other people to sign off on it, and realized how much politics and behind the scenes machinations between the hospitals and the various municipalities impacted what we were able to do. So when I came up to Pennsylvania, the group I was joining was in the process of building a physician-owned surgical hospital to do orthopedic surgery and kind of be a specialty hospital. And to me, that was very appealing because we were going to be able to try and control the whole process of getting people ready for orthopedic surgery. And it's different than it is for some of the other specialties. And part of the problem being in a general hospital is that you have to kind of share the pie equally. So everybody's fighting for OR time and admissions and space and resources. And if you get enough of a critical mass and you're all doing the same thing, then orthopedics gets priority. And I started off helping to build that hospital. And once we got it built, I realized there was a lot more about running a hospital that I didn't know, which is always difficult for surgeons to admit that they don't know anything. It's not in our makeup.
I have no idea what you mean.
Yeah. So it took some time. So that drew me back to some coursework that I did at the Harvard Business School through their executive education program. And it was programs that were set up by Michael Porter, who was a famous healthcare researcher. And he did a lot of work on advising for the ACA plan that was Barack Obama eventually passed. And Robert Kaplan, and it was a program called Managing Healthcare Delivery, and it was what they call a certificate program. So it was kind of like, essentially, I would say an MBA light. You've got exposure to a lot of different parts of management that was all focused on healthcare. So we did some things on operations, we did some coursework on negotiation, finance, leadership, and then different healthcare delivery models. And that program was very interesting because it drew an international cohort. So you had people from other countries where the healthcare systems were actually very different. And that was one of the most valuable parts of that whole program, was just seeing that there wasn't just one right way of doing things.
I bet it was.
Sometimes other countries, really cool. I thought, did it better. So that really turned me on to the whole, again, I guess that's the geeking out about the whole process of it. And that was so much of what they talked about, was how to make processes better to make our healthcare systems better and try and get some of the inefficiencies out of medicine and try and do all the things that we're trying to do and everything perfectly, right? We want to do outstanding clinical care. We want to do it at the least expensive way possible. And we also want patients to be happy, and we want our providers to be happy, right? So that's the IHI's quadruple aim now.
Mm-hmm.
Those kind of programs led me to additional coursework with the American Association of Physician Leadership, looking at leadership and some finance and negotiations. And then in my clinical practice and with my day job, I ended up in a position where I was the president of our group, and we had a little bit of financial difficulty. We ended up firing our chief executive officer, and we were going to go without a chief executive officer, although we've found out quickly that you weren't allowed to do that in the state of Pennsylvania. You had to have a CEO of the hospital, so that became my role as well. So I found myself very quickly in the president, CEO, and surgeon role for a few years. And
that's a lot of hats to wear.
It was, and that was a very difficult time for me just because of the hours that were involved. I was probably working close to 100 hours a week, doing everything because it was hard. My group didn't understand how much, because they had even less idea of how much administrative work was required to run a hospital than I did. We kind of, in some ways, treated it a little bit like a larger physician practice, which it's not. It's a completely different animal. And that's when I really realized I needed to go back and really learn some more stuff. So I took some more coursework, and that's when I did a master's in medical management at Carnegie Mellon through their graduate program.
Yeah, and it sounds like you found it really worthwhile.
Yeah, and that was, that's basically an MBA for medicine, and it's an MMM degree, which most people aren't as familiar with. I think there's only 2 or 3 places in the country that offer it, but basically it's doing all the same things you do in an MBA course, but it's all focused on medicine. So rather than learning about whole different, how to run a logistics company or finance or make money in the stock market or run other businesses, it's all focused on medicine and what things are related to medicine, because medicine is different. It's definitely a different industry than a lot of others that are out there, because there's this confluence of regulations from the government and a lot of government input, and your biggest payer is the government. And then you have a lot of private equity that's involved. You have a lot of private industry that's involved, and it's now close to almost 30% of our GDP is involved with, spending on the medical industry.
I'm wondering, is this at about the point where you began to take a really intensive interest in physician-led healthcare? I know that's a big interest of yours.
Yeah, currently I am the president of the Physician-Led Healthcare for America, which used to be the Physician-Owned Hospital Association, and that was trying to help what was slowly growing at the time, the whole concept of physician-owned hospitals, where we would, buy or run our own hospitals. And currently in this country, that's the only group that can't own hospitals is physician. That was actually a element of the Affordable Care Act that put a moratorium on building new physician-owned hospitals. I never thought that was such a good idea. I think physicians definitely should be the ones who are helping to lead and run healthcare. We're not necessarily the best at doing all of it, but I think we are in a unique position to understand all the aspects of it. It's a lot easier, and maybe I'm biased because this is the way I went through it, but if you have clinical training, it's a lot easier to get leadership training and learn about how to run a business than it is if you come at it the other way and you're running a business and have to learn about how clinical things work, because you just don't have the exposure. And it's important to be able to, I think, balance both of those. And that's one of the things our country is, I think, struggling with right now, because we have had essentially a corporate takeover of healthcare in many ways, and we're dealing with the fallout from that, as you see, of hospitals declaring bankruptcy and all the mergers that are going on. And, the mergers and acquisitions among hospitals looks like something out of, Wall Street in the 1980s and 1990s, where companies were merging right and left and getting bigger and bigger and bigger. And that's not always better, certainly with healthcare. If you look at an individual patient, they want a compassionate doctor who cares about them. And they just assume that they're going to get good treatment, good care. And most of them don't want to be treated by a corporation. They'd be happier. Sometimes they don't have an option.
I don't know if you are familiar with Dr. Wendy Dean, who actually is up in your territory, wrote a fabulous book called If I Betray These Words. She's been a guest on this show, and she delves really deeply into the effect that has occurred because corporate interests who have no interest other than profit are largely in control of healthcare in America today, or at least that's the way she sees it. And I have to say that I agree with you. And I wonder if you feel that that's a real thing and that it's important for physicians to be more aggressive about taking it back.
Oh, I definitely think it's a real thing. And I think she talks about the concept of moral injury, where you're
Indeed.
not able to provide the type of care that you feel in your heart is necessary. And that creates a conflict, right? Because we take an oath as doctors to do no harm, right? And then we're put in situations where we see harm being done to patients and there's nothing you can do about it. Mm-hmm. Whether it's because your employer or the insurance company won't approve it, or somebody's trying to cut money somewhere, or you have to refer to a certain doctor or practice because that's part of what's in your system, even though they may not be the best person for the job. And again, those are some of the unique situations that you see in medicine that we don't see in a lot of other industries. And we try and treat medicine like it's other industries, but at the core, we don't want it to be like other industries, right? Nobody wants to be just a widget or something, some part of an assembly line or just another number, right? We all want to be treated as individuals, and that makes the way our systems are set up, that makes it really difficult. And it's hard for the doctors. Unfortunately, more and more doctors are getting bought out in practices. That there are more doctors that are employed by hospitals and companies now than there are independent physicians. And that I don't think is a good trend for our country, at least not the way that things are currently set up. And that's where I think physician leadership is important, because we have to be the voice for the patients. We're their best advocate, because I know some wonderful venture capitalists that are well-intentioned people, but there's some out there that aren't so nice. And some people that are running hospitals don't necessarily have patients' best interest in mind, right? It's become more about how much money can you make rather than how many patients we can care for. And there are other factors that are unfairly dumped on the hospitals. Because we have a government that is barely functional at times, they can't address some of the social issues we have that are and they've basically thrown that onto the medical groups and told hospitals, here, you have to take care of all these indigent patients, and we're not going to pay you enough to do it. You just figure it out. And those are the social determinants of healthcare, where how can you treat a patient who's diabetic or has high blood pressure when they can't afford their medications, or when you go home, they have no food in the refrigerator because they have no money, or they live on the streets because they don't have enough money to pay for housing. Unfortunately, that happens far too often in big cities and rural areas where, people don't, we can do everything right. And then somehow the system breaks down because they can't get the medication or they can't get the treatment they need. And that's very frustrating. And I think we would be more willing to try and set up systems that take care of those types of things. At least in my mind, I feel that we are. But we're not always the ones who are in the rooms making those decisions. And that's unfortunate.
You are the president of Physician-Led Healthcare for America. Just take a minute or two and talk about that organization. And if someone is listening to this podcast that would like to be involved, how do they go about doing that?
We initially started out as a physician-owned hospital association. And like I said, back in 2008, when the ACA was passed, put a moratorium on physician-owned hospitals being built, and that went into effect in 2010. So since 2010 in this country, we haven't been able to build or expand any physician-owned or led facilities. We feel that that's a problem when they've looked at quality numbers and they've looked at patient satisfaction and they've looked at almost all the determinants of what makes a successful hospital. The physician-owned and led hospitals have always performed very well, and in fact, better than most other hospitals. And there's a lot of data that we have on our website and studies that show that there were more 5-star hospitals that were physician-led percentage-wise than any general hospitals. It's generally cheaper to have care done at a physician-owned hospital. The patient satisfaction scores are higher at physician-owned led hospitals. So there's a lot of good things that happen. There was a lot of pushback from the hospital industry primarily that doesn't necessarily agree with that, and they feel that cherry picking that happens and that overutilization that happens. And those are all things that, we personally find kind of insulting, and they're not true. And there've been research studies that have shown that the whole concept of cherry picking doesn't exist. And it's really crazy that they do the same things themselves within the hospital systems that they accuse us of doing. So that if I'm working for a hospital system and I'm an orthopedic surgeon for a hospital system, I have to bring all of my surgeries to my hospital. I'm not allowed to go somewhere else and do surgery somewhere else. I'm not allowed to send my patients to a independent radiology facility because I have to send them to my hospital because that's considered leakage. Right. Whereas, and they accuse us of doing the same thing. Oh, you're going to take these patients and just going to operate on them in your own facility. I'm like, yes, because my own facility is one that is less expensive and has better outcomes and has cheaper costs. And if we look at it from the systems standpoint, if you're looking at it from a policymaker standpoint, physician-owned hospitals are a great solution to saving money for the country and for the healthcare system in general. There was a study that came out last year that said if more care had been delivered at physician-owned hospitals compared to similar hospitals that are not physician-owned, the payers would have saved $11 billion. That's a huge number. And that's showing that there's, when you put these things out at scale, there's a huge advantage to having things done more efficiently. Despite what we're accused of, most of the doctors that are involved with physician-owned hospitals did it because they want to provide better patient care. Our primary focus was not to make more money. It's that I can treat more patients and I can do it more effectively and I have more control over the decision-making process. And that's what draws us to it. And that's what most physician-owned and physician-led facilities want. They're doing it because there's so many inefficiencies in our regular hospitals and ambulatory surgery centers that we want to have better control over that process. And that's what really drives us more than the profit margin. And more recently, we've expanded that because we realize things are changing. And so now we're also not just physician-owned hospitals, but also surgery centers and off-space surgery facilities where, again, physicians are the ones who are helping to lead and make these decisions. And sometimes it's in coordination with larger health hospitals, and they're very valuable partners in many of our ventures. And it can be with venture capitalists who also can be very valuable partners. But the kind of unifying theme is that the physicians are the ones who are helping to lead and run these organizations and decide on how things are done. And, we don't do everything ourselves. We still have people that help with logistics and help with payroll and help with finance, but, that's figuring out the balance and how to do that is a true art, and we have an art of medicine, but we also have an art of running a hospital and taking care of patients. And I think you have to have that holistic approach of understanding the entire healthcare system and all of these inputs that come in and the regulatory, there's so many stakeholders in medicine that it really is mind-boggling. I'm still a firm believer that I think physicians are still the folks that are the best positioned and best trained to be the ones guiding and leading those decisions, because we're able to kind of balance what healthcare is supposed to be for. Still understand that it has to make money and we have to be able to continue to make a profit to be able to keep treating the next generation of patients. But there are better ways of doing it than I think a lot of where we see the country now, where there's a lot of places that are struggling, like hospitals are closing. There's two hospitals, I think, in Wisconsin that were closing, and there's physicians that would buy the hospitals, but they're not allowed to, and keep them in those communities. We've seen a lot of closures of smaller community hospitals in the last 10 years because larger corporations buy them up and they don't need as many hospitals and they're trying to consolidate care. So they don't think anything of having a patient drive 3 or 4 hours to get to their nearest hospital. Whereas doctors realize that's a problem for a lot of patients. And we've got to figure out how to make those systems better.
Well, Joe, I really like how you have distilled the problem down to its very basics. And I really think you have truly got your eye on the ball, and I hope you continue to be successful. Makes no difference if you are a healthcare consumer or a healthcare provider. you got to know at this point in our development that something is really not going well. And I think your analysis of it is spot on. And I really congratulate you, and I thank you for getting involved in the way that you have, because obviously if we keep doing the same thing again and again, the result won't change. So kudos to you for leading the charge on that. I've really enjoyed our conversation today. And what I'd like to do at this point is step out of your way for a moment and let's hear from you on your own. And audience, this is Dr. Joe Alhadeff giving us his personal prescriptions for success.
Thanks again for the opportunity. I've enjoyed the conversation. I think success is different for every person, how they look at it. And the same thing isn't necessarily going to work for everybody. And over the course of my career, that you have to change and willing to be adaptable to different situations in order to be successful. And that was something I learned actually not so much in medical school, but more in management school at Carnegie Mellon and at Harvard, at the business school, in terms of leadership and understanding that there are different leadership styles for different situations that are sometimes necessary to be more of an authoritative figure. Sometimes it's better to be collaborative. Sometimes it's better to be inquisitive. And I think that that's a good basis for success, is to be adaptable, to not be so rigid that you can't change the way that you look at things or the way you approach things based on the situation, because the situation will change and it's never one size fits all. And you'll find that strategies that may have worked when you were younger aren't going to work when you're older. And you have to be able to have more than one trick in your bag to be able to be successful in different situations. And sometimes that requires going back and being humble and understanding that maybe you don't know the best way of doing things, and being willing to work at that and be self-aware enough to understand when things aren't working, or when you maybe aren't the best person for the job or aren't the best prepared, and then figure out how do you go about fixing that. And I think that's the key for me. It has been for success, is being able to understand when I needed to go back and get additional training or bring additional people in to help. And that success, especially in medicine nowadays, everything is more of a team sport. Things are collaborative. You work with teams in so many different areas of medicine now. And that's important, to be able to figure out how you work on teams and how do you leverage assets of other people to help you be successful. And sometimes personal success is linked to your team's success. And that's where that adaptability comes in, because you have to be able to change on the fly sometimes. And that's what's worked for me.
Well, I like how you phrase that. Looks like it comes down to be adaptable and work on your humility. A great recipe, I think. Joe, I really enjoyed the conversation today. Before we depart, I want to give you an opportunity to tell our audience where they can find you. If you'd like to share email addresses, websites, or whatever, please go right ahead.
Yeah, I mean, my email address for physician-led healthcare is jalhadeff@physicianled.us.com. My work email is jalhadeff@osshealth.com.
And Physician-Led Healthcare for America, does it have a website or anything where people can get information?
Physiciansled.com. And that has our current information and about some of the studies we have there, and talking about that Medicare savings and some of our more recent work.
Dr. Joseph Alhadeff, thank you very much for being with us on Prescriptions for Success.
And thanks again for the opportunity.
Thank you so much for listening today. If you enjoyed the show, please help us reach more listeners by leaving a rating and a review, especially on Spotify or Apple Podcasts. And if your app doesn't have that option, just leave us an email or a voicemail through SpeakPipe at www.mymdcoaches.com/podcast. You can also help by becoming a Patreon member. That link is in the show notes. And we hope you'll also follow our companion podcast, Life-Changing Moments with Dr. Dale Waxman. Special thanks to our producer, Craig Clausen, our promotions manager, Mariana Rodabaugh, and to Ryan Jones, who created and performs our theme music. And remember, be sure to fill your prescription for success with my next episode.